Good afternoon. And today I'm going to share the story about someone who had trouble sleeping. And I would share the story about sleeping with the partner as well, but in a very sad way, I would say. But again, that's a story of transformation, what we help people to go through on everyday basis. And I'm very proud to say that my team and myself, we directly participate in that transformation, and that bring us a lot of joy and make us to be excited to come to work every day. So again, I would like to tell you the story about George. This is a man in his 50s who recently retired. He faced several health challenges and emotional struggles due to the recent loss of his wife from breast cancer. He suffered from sleep apnea, high blood pressure, and atrial fibrillation. But he was reluctant to use the CPAP machine due to previous experience, and also he had a desire to find a new partner. And I offered him several treatment plans. One of them was traditional oral appliance, and another one was a combination of clear aligners, oral appliance with expansion, myofunctional therapy, and that combination of treatment helped. I had a vision what it's going to help to strengthen his tongue and improve sleep quality. But during the process, we discover what George, and it's a change name, had a severe tongue tie, and that contributed to his TMJ pain and sleep issue. And then we develop a new plan, and it's include a tongue tie release in addition to myofunctional therapy. And on top of it, we offer him zirconia veneers, what can help him to restore the damage caused by lifelong bruxism. And through that process, he feels so much better, and he was ready to embrace new connection in his life. So we met during virtual consultation, and I noticed what his eyes kind of vary, and he feel little bit sad, and I sense it even through the screen. But I really didn't know what George's journey leave such an indelible mark in my heart and challenge my perception of personalized care. So George's story unfolded during that virtual consultation, and I, as a doctor, I had the privilege of gaining more personalized insight in his life. And virtual consultation, especially after COVID, I find it is a very unique way of connecting with the patients. And embracing virtual consultation might be controversial in the medical world, but for me, it's led to deeper understanding of my patients like George. I listened to their story from the comfort of their own home. And as George looked through the screen, I could see like really tired eyes, and I have to close his eyes for the privacy issues. And his life was filled with both heartache and strength. And I could sense the grief, what he carried, a pain of losing his wife from breast cancer. And despite of support of his friends, he felt adrift, like unable to accept his loss. His heart was heavy with memories, and he struggled with mixed emotions. And in the middle of that fog of emotional struggles, George's health also suffered. Usually it goes hand to hand. And he was burdened by sleep apnea and high blood pressure with multiple medications. That's usually happens when patients have a sleep apnea and doctors prescribe 1, 2, 3 4 medications and atrial fibrillation. He was really scared about that. And he didn't want to use a CPAP machine because he didn't like the discomfort of it, but also he was hoping to find a new love. And what I understand after meeting George, what this treatment have to go beyond numbers and diagnosis. I really want to bring spark of happiness into his life. And we discuss different plans, but I want to offer him something that can address physical and emotional aspect of well-being together. So I offer him several treatment plans. First one was a traditional oral appliance, and another one was a combination of clear aligners, oral appliance therapy with the expansion, and myofunctional therapy. And again, I want to mention what myofunctional therapy play critical role in addressing sleep apnea and health issues. I'm a big proponent of that. It improves function muscles of the tongue and the throat, and it's helping to correct proper tongue position and breathing habits. And for George, myofunctional therapy promised not only better sleep, but chance to discover his smile, because I want to address temporomandibular joint issues. During the therapy, we teach George to breathe through his nose instead of his mouth, very common habit of a lot of sleep apnea patients, and that helped to reduce his snoring and sleep quality. And an additional exercise helped to strengthen his tongue, helped to elevate the tongue to the roof of the mouth, and addressing tongue tie. We discovered what tongue tie he is willing to address, and that also helped with TMJ issues when tongue is on the roof of the mouth. And also myofunctional therapy teach George how to swallow correctly, and this way he can use the strength of his tongue 24/7. And address symptoms of the bruxism condition what characterized by tooth grinding. So this is the clear aligners what we use in his therapy. I want to use them to align his teeth and expand the arches to create more space for George's tongue on the roof of the mouth. And also I use that to correct the teeth crowding, but I can prepare his teeth for zirconia veneers without losing any tooth structure. I really believe in a conservative dentistry, and I want to make his bite less deep. That's going to be better for longevity of the restorations. And as George progressed through the journey of healing, the transformation was remarkable. George was using this appliance, it's a top portion of this appliance, with clear aligners, and it's improved his sleep quality and relief from sleep apnea, restored his energy and boosted his cognitive clarity and lifted his mood. And feeling refreshed, George was ready to embrace his life with renewed purpose and enthusiasm. And that equally impactful was a restoration of his smile with zirconia veneers. And beyond the aesthetic aspect, transformation instilled newfound confidence in George. And he allowed him easy to engage with others and embrace new connections in life. And George's transformation not only about the look. It's kind of a new smile reflected his inner change from grief-striking to joyful and self-assured. And I can say I learned a lot with George. What healing goes beyond physical, it encompasses emotions and determination and human connection. And with compassion, creativity, and commitment, we embark on this beautiful transformation, intertwined medical and dental and emotional aspects. And what I learned from George's experience, it's the significance of comprehensive healthcare. What I understand, toll of loss and his desire for happiness, and also not only improve his sleep and health, but also to have a profound effect on his life. In conclusion, I want to say what personalized care and precision medicine can create remarkable change. And with innovative therapy and empathy, we guided George towards relief and rediscovery of happiness. And every patient journey is unique in waiting to be heard and nurtured. And as a healthcare providers, my team and I, we have a privilege to be catalyst of healing and hope. Thank you very much for listening. And if you have any questions about George's journey, please put it in a comment. I would be very honored to answer your questions.